People who use drugs have been calling for safe supply for decades. They want access to a regulated drug that is of known quality and strength. When people rely on buying through the illegal drug supply, they don't know what they're getting. These days, the illegal drug supply is extremely unpredictable and toxic. This puts people at harms like infections, overdoses, and death. Something had to be done. We started providing a small group of people who were at very high risk of harms with a prescription for hydromorphone tablets. Every day, they would go into their pharmacy, get 1 day's worth of tablets. Many also take a longer-acting opiate like slow-release morphine or methadone as well. They take this longer-acting medication at the pharmacy as an observed dose. We saw people doing amazingly well. Their substance use started to stabilize, they became more engaged in healthcare and social services, and they started to report feeling better. When we talk about safer supply, we are talking about a harm reduction approach that helps people reduce their use of drugs from the unpredictable, contaminated, illegal supply. The goal is not treatment or abstinence. The goal is to provide a drug of known quality and potency so that people can manage their substance use as safely as possible. A second goal is to offer clients access to primary care and wraparound supports to help them with their self-defined goals.
Our team sees every interaction between clients and staff as an opportunity to build relationships and find out how best to provide what that particular individual needs and wants. We offer 2 types of syringes. The 1cc and 3cc are what clients will ask for. We also have safer inhalation kits, foil smoking kits, safer crystal meth smoking kits, and condom kits.
Some of our clients come into the respite space so our healthcare team can monitor them a little bit closer for a while. It could be that someone has an injury or that they are sick and want to keep an eye on them and make sure that they are as safe and comfortable as possible. Some of our clients are uncomfortable going to the hospital because of negative past experiences. We are known as a safe place to come so that they can be properly assessed and monitored. We address food insecurities by providing food and information about community resources.
In healthcare, there are best practices that we are expected to follow when providing certain types of care. In the cases of prescribing opiates as safer supply, one of those practices is urine drug screens. We explain that there are 2 reasons for the test. First, if people are using drugs from the street drug supply, testing their urine lets us get a picture of what's in the current street supply. The second reason is that we can confirm that they are taking the medications that we are prescribing to them.
When meeting with a client, I begin the visit by asking if they have any new concerns for today's visit, or if they are here for a regular check-in. Depending on a client's goal or priority for the day, this guides the tone of the visit. Some clients may have larger health pieces they would like to briefly discuss, but they do not feel like they have the time today to address them. Others are quite stable and here for a brief check-in. Some folks we work with may have larger ongoing pieces that require some time, such as wound care or coordination of services. And then others present in a state of crisis where we are only able to address acute concerns. The nursing check-in is designed to create opportunities to discuss new health concerns and screen for red flags, which would be escalated to their prescriber to assess in person.
I really aim to help Crystal avoid relying on drugs from the contaminated, unregulated street supply. I want to determine what changes we need to make in her medications to help make her more comfortable and experience the effects that she's seeking, whether that's withdrawal relief or euphoria or both. Sometimes people feel embarrassed or ashamed if their use has increased or if they're injecting more than they were at the last visit. This is often because of their experiences with programs aimed towards abstinence and programs that have more carceral models. I ensure they know I'm there to support them in all of their goals, whatever their goals are.
A client might tell me that they are tired of living outside with no place to go. I'll check to see if they have connected with our local coordinated housing access service and if they have completed their housing assessment. We also ask if this person has completed their rent geared to income housing application. I'll ask them about their experiences searching for housing and find out what kinds of barriers they have faced. I'll ask if they need any support to help them maintain housing, like nursing, PSW, or a housing stability worker. We'll talk about what we need to do to help them move forward with securing housing and make the calls to find out the status of their existing applications. But we'll also make sure that they have what they need immediately.
At LIHC, our focus is on our clients' self-defined goals and needs. Our goal is to provide a safe, welcoming space where we can build supportive relationships. Our Safer Supply program is built on the values of harm reduction, persistence, and hope.